Hi, greetings students. This is me, Dr. Tiwari, and today I'm back with my new video. I hope every one of you will like this, and this video is especially for usmle, plab, and nclex students. Okay, yes, this can be helpful to even the medical students or the nursing students in the nursing colleges. But I have made this especially for competitive entrance preparation, or let's say competitive examinations and licensing examinations. Uh, to move forward, today we are talking about very essential aspect of mental health delivery system. It's more as what the psychologists do, and that's psychotherapy. So in the examinations, the questions will be for example, a person has borderline personality disorder. Which among these is the best uh, psychotherapy technique? So you have to choose dialectical behavior therapy, and then so most of the time you choose cognitive behavioral therapy for different other questions when you have to choose motivational therapy. So yes, systematic desensitization for phobia. So these are the different topics that we'll be discussing, and you may see some of the questions from this topic as well. As always, what I suggest is that if you feel the speed of the video is slow, you can always increase the speed in YouTube. And if you're revising this for the second time, I suggest you to save some time, okay, and increase the speed. So let's move forward. So what is psychotherapy? Psychotherapy is the primary goal of psychotherapy is to help patients understand their thoughts, emotions, and behaviors to achieve better coping skills and personal growth. It literally rewires the brain response to stress and emotion, creating lasting neurological changes that support mental wellness. So, what is psychotherapy? It's whenever the person will be having some sort of mental dilemma or mental problems, uh, and if it's not in the condition that he or she immediately requires the psychotherapy, and if specific psychiatric disorder condition is not made, if the criteria doesn't match with the major depressive disorder or schizophrenia, but it's more like a mental problem or mental dilemmas or the stresses because of different life scenarios, then at that time some sort of psychotherapy is helpful. And here uh, the psychotherapist tries to understand the person's thoughts, emotions, behaviors, and help to develop better coping skills, help to develop personal growth, and by some sort of techniques which helps to rewire the brain's response to stress and emotions. Okay, now there are different therapies, out of which one is behavioral therapy. So in behavioral therapy, what we do is that we focus on changing action first and thoughts follow naturally. Okay, so that means uh, it's example, let's take we do systematic desensitization. Okay, so systematic desensitization is a part of behavioral therapy. So it gradually exposes patients to feared stimuli in a controlled and safe environment. So let's say a person has anxiety disorders, for let's say flying the for let's say of height. Okay, if the person has phobias for height, then in systematic desensitization, instead of leaving the patient directly to the 20th floor, the therapist asks the patients to go to the second floor, third floor, fourth floor, and eventually he develops coping skills to deal with that stimuli. And then later, after a few trials, after a few months, even on 20th floor, he or she will stop feeling that phobia. So here the therapist is trying to focus on changing action first, and thoughts are following naturally. Okay, so it's also used in this behavioral therapy is also used in obsessive compulsive disorder, specific phobias, as I said, and habit disorders. And its core mechanism is classic and operant conditioning principles. Okay, that is changing maladaptive behavioral by systematically reinforcing positive ones. So in that previous example, if the person would have developed fear, phobia in the 20th floor, instead of sending direct to the 20th floor, the person is suggested to go first to the second floor and look down. And with this, now he will slowly start coping with and slowly reinforce positive thought pattern or positive bodily response, and eventually when he goes to the 20th floor, he won't feel that level of anxiety and eventually will heal. So that's behavioral therapy. Next, very important and most common is cognitive behavioral therapy. In this, what we do is focus on powerful connection between thoughts, emotions, and actions. Okay, so here the first thing the therapists do is identify the distorted thoughts. So let's say a person is having depression. So depression may be because of anything like poor school performance. So in that case, the physician, as a physician, you have to identify the negative thinking patterns or cognitive distortions that is present in the individual, and then you examine, let's say, you help to develop healthier thought patterns that lead to improved behavioral and emotions. Okay, so also along with depression, it is also used in anxiety disorders, eating disorder, insomnia, PTSD, panic disorders, etc. Yes, the example, I think this will help you. A patient is experiencing panic attacks, learns to replace catastrophic thoughts like I am having a heart attack with a realistic appraisals like this is anxiety, it's uncomfortable but not dangerous. So in cognitive behavioral, what we said is that you have to first identify the person's or the patient's distorted thought. So here in this case, the patient will a panic disorder patient will always feel that whenever he's in panic, he will think that, oh, I have got a heart attack, and he will rush to the hospital, and but he will never be diagnosed as MI, and after a few hours in the hospital, he will be sent back to home. And one day he came to you as to meet at the therapist, and what you have to understand is that, okay, his problem, first you identify his distorted thought. His problem is that whenever he develops anxiety physical manifestations, he thinks that as a heart attack, so that is worrying him. Okay, so you first identified his distorted thought, and then you challenge and restructure it. You will provide evidence also in the internet or something like, okay, it's not always the chest pain, it's not always the heart attack, it may be, and you also teach him about anxiety, it may be because of the anxiety, it may be because of PTSD. You challenge and you restructure him, and later what you expect is that you expect a lasting change. So from next time onwards, as this patient has redirected his thought that, okay, although my chest pain, it is uncomfortable to me, but it is not dangerous because it's a part of anxiety rather than myocardial infarction. So now he has developed a lasting change in his mind, so this will help him in the subsequent panic attacks. So in this way, you first identified his distorted thoughts, challenged and restructured him, and helped him to create a lasting change. So this process is called cognitive behavioral therapy. Next is dialectical behavioral therapy. It is another very important question. Okay, it is frequently asked in the examinations. Okay, so one thing most important here is two words. One is mindfulness. Whenever you see CBT technique with mindfulness practice, then you think about this. And next is the question will be asked is what therapy is helpful for the person with borderline personality disorder, and the answer is dialectical behavioral therapy. Okay, it's a gold standard treatment. Also, you can use this in self-harm behaviors, eating disorder, substance use disorder, and severe emotional dysregulation. But most important one is borderline personality disorder. So in this disorder, just think about borderline personality. So what will they be doing in the crisis? They will start harming themselves. They will cut their wrist or something like that. So in cognitive behavioral therapy, in dialectical behavioral therapy, the person will be taught about distress tolerance, so skill to survive crisis situations without making them force through impulsive actions. Okay, so they will be taught about how to channel their impulsive thoughts or impulsive actions from harming themselves. So this is distress tolerance that is taught here. in dialectical behavioral therapy. Next is emotional regulation. The borderline personality disorder, they will have intense emotional experiences within themselves. So here the technique is about emotional regulation, teaching the patients about emotional regulations, ways of emotional regulations. And third is interpersonal effectiveness. Here the person with borderline personality disorder will always have difficulty maintaining relationship. So for that, interpersonal effectiveness, communication strategies and such things are addressed here. And similarly, as I said earlier, mindfulness is most important. So mindfulness is taught here, in which present moment awareness without judgment is the foundation of DBT skills. Okay, so mindfulness is like living at the moment instead of procrastinating, instead of thinking about the future and all the bad thoughts, just living in the present. So the important things from dialectical behavioral therapy is that it's most important it's a gold standard for therapy for borderline personality disorder. In this disorder, CBT with something. Oh, okay. I'm sorry. I was short break. I'm continuing now. Yes. So dialectical behavioral therapy, we have learned about this. It always comes with mindfulness, and always keep in mind borderline personality disorder. And yes, it helps to deal for tolerance of distress, emotional regulation, increasing interpersonal effectiveness, and mindfulness. Okay. Now next is interpersonal therapy and motivational interviewing. Okay, so interpersonal therapy is like it helps to improve the communication pattern and social functioning to alleviate the symptoms. So let's say a person has major depression, and if he is not communicating with his family members or his friends, circles, or if he has a postpartum depression, if he or she is in grief for a long time, so we often say that a person has to speak up, share his emotions, to vent his or her feelings or her griefs. So in relationship difficulties, and in these cases we go with interpersonal therapy, in which it is taught to share or express one's inner thoughts. Okay, and similarly we have motivational interviewing. It's like it's used for substance use disorder, smoking cessation, for weight loss, for medication adherence, and any behavioral change thing. What we do here is we enhance the person motivation so that he or she will opt for behavioral changes. Like, for example, in substance use disorder, the person will be feeling that he or she has a very bad habit now, and he wants to quit but couldn't quit, so he'll be in such phases. If he or she is in such phases, then we go with motivational interviewing, in which we enhance his motivation, because he has already started feeling that he wants to quit but he could not quit. So rather, now we increase his motivation, saying, okay, you can do this. You have to think of the positive side. So what your life will be if you made this change. So in this way, we try to bring the more positive thoughts in his mind, so that he can cope up and help or bring the progressive behavioral change. Okay, so that's motivational interviewing. Now, supportive and family-based therapy. Supportive therapy is, again, we rather hear than we fix anything. Okay, in supportive therapy. So in supportive therapy, we provide a hearing, and that's a stable foundation during difficult times. So we provide supportive therapy, and if the person is in acute distress, if the person has crisis intervention, we do it for crisis intervention. If the person has a chronic medical illness, that's a cancer, then you can't do anything. The physician, the oncologist will do the thing. But as a psychotherapist, you just listen and be more supportive. Okay, so that's what we do in supportive therapy. We also do it for severe mental illness, maintenance, and other life stressors. And next thing is family therapy. And this concept, what we think is that we heal the system, not just the symptom. That is, let's say a person has a child in the family has adolescent behavioral problems. Now with the whole family needs to adapt to that situation, needs to needs a collective effort in bringing the behavioral change in the child also. So this way of therapy in which whole family dynamics is involved, and in which the family is taught about the communication patterns and their respective roles in the family to deal with the problem of an individual in the family, then we say it as a family therapy. So again, we do it for adults and behavioral problems, eating disorder in youth. So which is the family members, how they can deal with that, how to cope with that, how to encourage your child for against the eating disorder and something like that. And against schizophrenia relapse and the relapse prevention. If anyone in the family has schizophrenia, the whole family unit needs many counseling and therapy to how to adapt themselves and how to bring and play their roles in bringing the positive changes in the patient. So this is about family therapy. Again, if the family has a member who has a habit of substance use, then again in that case we may need to provide them the family therapy. Now next is group therapy. In this therapy, there will be 6 to 12 different peoples in a group who have had similar life experiences, and will it's especially for substance use disorder or grief and loss cases, in which the person or its individual members in the group will have substance use disorders or will be in grief or in loss, and then they all come up together, motivate one another, provide mutual support, learn each other's coping mechanism, and hence navigate through that difficult times. So yes, and this modality of treatment or therapy is also cost effective. Okay, so this is group therapy in which whole group comes up, share their experiences, share their coping skills, provide one another with mutual support, so that the every group members can cope up with the situations, especially in case of grief reaction or substance use disorders. Now next is psychodynamic or insight oriented therapy. So in psychiatry, what we say is that our behavioral today maybe as a result, or our behavioral or our thought pattern maybe because of the unconscious conflicts that we had deep down in the past or maybe in the childhood. So in this case, as a psychotherapist, you try to explore the unconscious conflicts or the defense mechanism that was used by an individual, either long ago or let's say in their childhood, and that is to find out the culprit for their current behavioral or thinking pattern. Okay, so in this way the therapist tries to explore what happened in the past, what was his childhood like, what made him think this way, and finally you try to understand and try to fix not the present condition, okay, but you try to fix the thinking pattern since that point in the past. For this, the key techniques used by the psychotherapist are free association, dream analysis, transference interpretation, okay, and it's especially used for personality disorders. Let's say you have seen in the movies something like that. A person will be, let's say in the childhood, he may have seen a lot of trauma, lots of abuses, and in the adulthood he may have become a criminal, and then you try to find out the reasons back in the past, and that's what a psychodynamic psychotherapy, and then you try to fix that, and then you expect a behavioral change today. Also used for chronic depression, relationship patterns, again identity issues. So the theme is understand the past to heal the present. So there are other therapies like exposure therapy, which said it earlier to systematic desensitization is an exposure therapy also. So used for phobias and PTSD. There is another called EMDR, which stands for eye movement desensitization and reprocessing. So this is used for PTSD and trauma. Mindfulness therapy, we said it earlier, also especially for borderline personality disorder, also for depression relapse, prevention, chronic pain management. Okay, and mindfulness is a part of dialectical behavioral therapy. Play therapy is used for pediatric trauma, pediatric anxiety, developmental challenges. Okay, couples therapy is used to improve the relationship satisfaction, communication, and conflict resolution. So we learned about the different therapies here, and the basic thing is that whenever the patient comes to you, and when you are as a therapist, your role is as a therapist. Let's say in the examinations, the question frames you as a therapist, and in that case, you have to first evaluate the symptoms, severity, chronicity of the patients, and the patient insight level. Okay, and then you have to try to identify the treatment goals. Okay, consider patient factors while determining the treatment goals. We say that we have to match the therapy to the patient, not just the diagnosis. Okay, now that means you have to understand the patient factors, and then after that apply evidence-based proper specific psychotherapy that is most suitable to that individual. Okay, and you have to regularly monitor, and you may be flexible in switching the therapies, techniques, and so on. And finally, effective follow-up, good counseling is required in hitting the patient. So in this video we talked about a lot of psychotherapies. Okay, and I hope all these will be very helpful for you in the examinations. If you ever get any topics questions from there, the dialectical behavioral therapy, CBT, systematic desensitization, these are quite the common questions that will be asked in the examinations. So yes, I hope you got a holistic knowledge about the psychotherapy here. You got the definition of psychotherapy, you understood the behavioral therapy, cognitive behavioral therapy, you understood dialectical behavioral therapy, interpersonal and motivational interviewing, you understood about the supportive therapy, family therapy, you also understand about the group therapy, and psychodynamic psychoanalysis or insight-oriented therapy, and also you learned about exposure therapy, EMDR, mindfulness-based therapy, play therapy, couples therapy. So, and then you understood how do you play your role as a therapist. Okay, now with this I think we complete this session. I hope you find this very important in your examinations preparations, special preparations. After watching this video, I'm sure you'll be able to solve almost 80 to 90% of the questions that will come from this topic in your any competitive examinations. And I suggest you to like, comment, share, and subscribe this video to your colleagues as well. Share this with the colleagues so that I can come up with the more interesting videos for you, and that will be very highly helpful for you in examinations. Bye, see you in the next video.